Erectile dysfunction, impotence. Facts: erectile dysfunction, ED, also known as impotence, is the inability to have a hard erection initially and/or to have a hard erection that lasts long enough for sexual activity. Symptoms of erectile dysfunction include lack of an erection hard enough for penetration and/or lasting long enough for completion of sexual activity. ED may occur with or without other sexual dysfunction, including decreased libido, decreased interest in sexual activity, orgasmic dysfunction, troubles achieving an orgasm, climax, and ejaculatory dysfunction, problems with the fluid release during sex, including lack of ejaculation, small volume ejaculate, and pain with ejaculation. Erectile dysfunction is common, and the risk of developing ED increases with age. Experts have estimated that erectile dysfunction affects 30 million men in the United States. The causes of erectile dysfunction include aging, high blood pressure, diabetes mellitus, cigarette smoking, atherosclerosis, hardening of the arteries, depression, nerve or spinal cord damage, medication side effects, alcoholism or other substance, drug abuse, pelvic surgery including radical prostatectomy, pelvic radiation, penile, perineal, pelvic trauma such as pelvic fracture, Peyronie's disease, a disorder that causes curvature of the penis and sometimes painful erections, and low testosterone levels. Erectile dysfunction is treatable in all age groups. Treatments include psychotherapy, adopting a healthy lifestyle, oral PDE5 inhibitors, Viagra, Levitra, Cialis, Stendra, and Staxin, intraurethral prostaglandin E1, Muse, intracavernosal injections, prostaglandin E1, Caverject, Edex, Bimix and Trimix, vacuum devices, surgery, and, in some cases, changes in medications when appropriate. Before using over-the-counter products and/or supplements, a discussion with a doctor is strongly recommended. New research is ongoing in the field of erectile dysfunction to find improved and effective therapies. No matter what erectile dysfunction treatment or treatments, whether herbal remedies or not, a man ultimately decides upon. Experts say it's important to eat healthily and to avoid smoking and heavy drinking. Moreover, adequate exercise, stress reduction, and sleep can improve erectile dysfunction in many. Learn more about impotence remedies. What is erectile dysfunction, ED? Erectile dysfunction, ED, also known as impotence, is the inability to achieve or sustain a hard enough erection for satisfactory completion of sexual activity. Erectile dysfunction is different from other health conditions that interfere with male sexual function, such as lack of sexual desire, decreased libido, and problems with ejaculation, release of the fluid from the penis, ejaculatory dysfunction, and orgasm, climax, orgasmic dysfunction, and penile curvature, Peyronie's disease, although these problems may also be present. ED affects about 50% of men age 40 and over. This article focuses on the evaluation and treatment of erectile dysfunction. What is normal penis anatomy? The penis contains two cylinders, called the corpora cavernosa, which are on the top of the penis, see figure 1 below. These two cylinders are involved in erections. The urethra, the tube that the urine and ejaculate passes through, runs along the underside of the penis and is surrounded by tissue known as the corpus spongiosum. The corpora cavernosa are made up of spongy tissue that has muscles, fibrous tissues, veins, and arteries within it. The inside of the corpora cavernosa is like a sponge, with potential spaces that can fill with blood and distend. A layer of tissue that is like saran wrap, called the tunica albuginea, surrounds the corpora. Veins located just under the tunica albuginea drain blood out of the penis. Picture of arteries and veins involved in erectile dysfunction, ED. Source: NIH. How common is erectile dysfunction? Readers' comments. 4. Share your story. Erectile dysfunction, ED, impotence, varies in severity. Some cannot have an erection at all, whereas other men sometimes have troubles getting a hard erection, and others get a hard erection, but it only lasts for a short period of time. Approximately 50% of men over the age of 40 have troubles with erectile dysfunction. While erectile dysfunction can occur at any age, the risk of developing erectile dysfunction increases with age. According to the Massachusetts Male Aging Study, the prevalence of erectile dysfunction was 52% in men 40 to 70 years of age. The prevalence of complete erectile dysfunction increases from 5% at 40 years of age to 15% among men 70 years of age and older. How does erection occur? Erections are neurovascular events, meaning that nerves and blood vessels, arteries and veins, are involved in the process of an erection and all must work properly to get a hard erection that lasts long enough. Erection begins with sexual stimulation. Sexual stimulation can be tactile, for example, by a partner touching the penis, or by masturbation, or mental, for example, by having sexual fantasies, viewing porn. Sexual stimulation or sexual arousal causes the nerves going to the penis to release a chemical, nitric oxide. Nitric